Have you ever felt your heart flutter for no reason? Maybe you climbed a flight of stairs and found yourself gasping for breath more than you expected. Or maybe you noticed a strange fatigue settling in, the kind that sleep doesn't fix. You brushed it off, told yourself it was stress or age or just a busy week. But what if your body was trying to tell you something important? Hi, I'm Dr. Alex Rowan, and today we're talking about something that affects millions of people around the world and yet goes undetected far too often: heart valve disease. It's one of those conditions that builds quietly, sometimes over years, sending out small signals that most of us simply don't recognize. And today, I want to walk you through 7 of the earliest warning signs you can actually notice in your own daily life, so that if something isn't right, you catch it early when it matters most. Let me give you a sense of the scale of this problem, because I think it'll help you understand why paying attention to these signs genuinely matters. Heart valve disease affects an estimated 2.5% of the population in high-income countries, and that number rises significantly with age. By the time people reach their 75th birthday, studies suggest that approximately 1 in 8 people have at least moderate valve disease. That's not a rare condition. That's an enormous number of people walking around, many of them undiagnosed, many of them attributing their symptoms to something else entirely. And here's what makes this particularly important to understand. Heart valves don't fix themselves. Unlike some conditions where lifestyle changes alone can reverse the damage, a significantly diseased heart valve eventually needs medical intervention. The good news, and this is genuinely good news, is that when valve problems are caught early, before the heart muscle itself becomes weakened or damaged, outcomes are dramatically better. Modern medicine has incredibly effective treatments for valve disease, but timing matters. So let's talk about what to watch for. The first sign I want to talk about is one of the most commonly reported, and also one of the most commonly dismissed: shortness of breath that feels disproportionate to what you're doing. Now, everyone gets winded sometimes. If you sprint up 3 flights of stairs, some breathlessness is completely expected. But I'm talking about something different here. I'm talking about finding yourself short of breath during activities that used to feel easy: walking across a parking lot, carrying groceries from the car, climbing 1 flight of stairs at a comfortable pace. Or, for some people, shortness of breath that comes on when lying flat in bed. This is worth pausing on, because it's a symptom that many people find strange and alarming, but don't always connect to their heart. When a heart valve isn't functioning properly, particularly the mitral valve, blood can back up into the lungs. When you lie down, that fluid redistribution can make breathing feel genuinely difficult. Some people find they need to sleep propped up on 2 or 3 pillows without fully understanding why. If you've noticed this pattern, breathlessness during mild exertion, or difficulty breathing when you lie flat, please don't chalk it up to being out of shape without at least having a conversation with your doctor. It may be nothing serious, but it's worth checking. The second sign is fatigue, but not the ordinary kind. We all know what tired feels like after a long week or a poor night's sleep. That kind of fatigue makes sense. It has an obvious cause, and it resolves with rest. The fatigue associated with heart valve problems feels different. It's a deep, persistent tiredness that doesn't seem to respond to sleep or rest. People often describe it as feeling like their body is running on reduced capacity, like someone quietly turned the dial down on their energy levels without a clear reason. This happens because when a heart valve is leaking or narrowed, the heart has to work harder to maintain adequate blood flow throughout the body. Over time, that extra workload takes a toll. The heart muscle compensates. It thickens, it enlarges, but this compensation has limits. And as the heart's efficiency drops, so does the amount of oxygen-rich blood reaching your muscles and organs, which translates directly into that persistent, unexplained exhaustion. Now, fatigue is one of the most non-specific symptoms in medicine. It can be caused by dozens of different things: thyroid issues, anemia, sleep apnea, depression, and many others. So I'm not suggesting that tiredness automatically means heart valve disease. What I'm saying is that unexplained, persistent fatigue, especially when combined with any of the other signs I'm describing today, is something worth taking seriously and investigating properly. The third sign is something that tends to get people's attention quickly: heart palpitations. That sensation of your heart fluttering, racing, skipping a beat, or pounding in your chest in a way that feels unusual or uncomfortable. Now, occasional palpitations are very common and often completely harmless. Stress, caffeine, dehydration, and anxiety can all cause them. But palpitations that are frequent, that come on without an obvious trigger, or that are accompanied by dizziness or breathlessness, deserve proper investigation. Here's the connection to heart valves. When a valve isn't working properly, it disrupts normal blood flow patterns within the heart. This can create abnormal electrical signals that manifest as irregular heartbeats, what doctors call arrhythmias. Atrial fibrillation, for example, is significantly more common in people with heart valve disease, particularly mitral valve disease. If you've been experiencing palpitations that feel new, frequent, or that come with other symptoms, an electrocardiogram, an ECG, is a simple, non-invasive test that can tell your doctor a great deal about your heart's electrical activity. Don't ignore your heart talking to you. The fourth sign is one that people often attribute to other causes: swelling in the lower legs, ankles, or feet. The medical term is edema, and it occurs when fluid accumulates in the body's tissues. In the context of heart valve disease, this happens because a struggling heart isn't pumping blood forward efficiently enough. Pressure builds up in the venous system, the blood vessels returning blood to the heart, and fluid leaks out into surrounding tissues, particularly in the lower limbs, because gravity draws it there. You might notice your socks leaving deeper indentations than usual at the end of the day. Your shoes might feel tighter in the afternoon than they did in the morning. Your ankles might look puffier than normal. Again, ankle swelling has many possible causes: prolonged sitting, certain medications, venous insufficiency, kidney problems. But swelling that is new, progressive, or that appears alongside other symptoms like breathlessness or fatigue is a combination worth reporting to your doctor. The pattern of symptoms together is often more telling than any single symptom in isolation. The fifth sign is dizziness or lightheadedness, particularly when it occurs during or just after physical activity. When a heart valve is significantly narrowed, a condition called stenosis, the heart has to generate much higher pressures to push blood through the restricted opening. During exercise or exertion, when the body's demand for blood flow increases, a severely narrowed valve simply can't keep up. The result can be a sudden drop in the blood pressure reaching the brain, which manifests as dizziness, lightheadedness, or in serious cases, fainting. Fainting during or after exertion, what doctors call exertional syncope, is considered a warning sign that should prompt urgent medical evaluation. This is not something to wait on. For most people, the symptom presents more subtly: a brief moment of feeling off or unsteady when standing up quickly or during a brisk walk. But if you notice this pattern, dizziness linked to activity, please mention it to your doctor. In the context of aortic stenosis in particular, this symptom carries real clinical significance. The sixth sign is chest discomfort, and I want to talk about this one carefully because chest pain means different things to different people, and it's important to be precise. In a chest trichan ceterijorites, the chest discomfort associated with heart valve disease is often described as a pressure, tightness, or heaviness, particularly during exertion. It may come on when you're physically active and ease when you rest. This pattern occurs because a narrowed valve restricts blood flow to the coronary arteries, the vessels supplying the heart muscle itself, during periods of increased demand. This is different from the sharp, stabbing, localized chest pain that tends to be musculoskeletal in origin. That kind of pain, which changes with movement or touch, is usually not cardiac, but pressure or tightness in the chest during exertion, especially if it's new, recurring, or getting worse, warrants a proper cardiac evaluation. And I want to be direct here. If you ever experience sudden, severe chest pain, pain radiating to your arm or jaw, sweating, or breathlessness at rest, please seek emergency care immediately. Those symptoms require urgent attention regardless of their cause. The seventh sign is a little different from the others. If you've ever been told during a routine physical that your doctor detected a murmur, you may have been sent away with a reassurance that it's innocent or nothing to worry about. And in many cases, particularly in children and young adults, that's entirely true. Innocent murmurs are common and harmless. But in adults, particularly older adults, a newly detected murmur, or a murmur that has changed in character, deserves further investigation. A murmur is simply the sound of turbulent blood flow through the heart, and a leaking or narrowed valve produces characteristic sounds that an experienced clinician can detect with a stethoscope. If a murmur is detected, the standard next step is usually an echocardiogram, an ultrasound of the heart. This test can visualize the valves directly, assess how well they're functioning, and determine whether any intervention or monitoring is needed. If you've been told you have a murmur and never followed up with an echo, that's worth revisiting with your doctor. So, let's bring this all together into something practical and actionable, because information is only useful if you know what to do with it. If you recognize one or two of these signs in yourself, don't panic, but do pay attention. Make a note of what you're experiencing, when it happens, how long it lasts, and what you were doing at the time. That kind of detail is genuinely useful to a doctor trying to understand your symptoms. If you recognize several of these signs, particularly breathlessness, fatigue and swelling occurring together, or dizziness with exertion, or chest pressure during activity, schedule an appointment with your doctor and describe your symptoms clearly. Ask specifically about cardiac evaluation. The most important diagnostic tool for heart valve disease is the echocardiogram. It's non-invasive, it doesn't involve radiation, and it gives an extraordinary amount of information about how your heart valves are functioning. If your symptoms warrant it, advocate for this test. And if you've been diagnosed with heart valve disease and are currently being monitored, keep your follow-up appointments. Valve disease can progress, sometimes gradually over years, sometimes more quickly, and regular monitoring allows your medical team to time any intervention appropriately before the heart muscle itself is compromised. Living with known valve disease doesn't mean living in fear. It means staying informed, staying in communication with your healthcare team, and making the lifestyle choices, regular moderate exercise where appropriate, heart-healthy nutrition, not smoking, managing blood pressure, that support your heart's long-term health. Your heart is extraordinary. It beats roughly 100,000 times a day without you ever having to think about it. Paying attention to the signals it sends is one of the most important things you can do for your long-term well-being. I hope today's video gave you something genuinely useful, a clearer picture of what heart valve disease can look like in real life, and the confidence to take your symptoms seriously if something doesn't feel right. I'm Dr. Alex Rowan, and this channel exists because I believe that understanding your own health is one of the most empowering things you can do. The more you know, the better the conversations you can have with your own doctors, and the better the decisions you can make for yourself and the people you love. If you found this video helpful, I'd love for you to subscribe. I put out new videos regularly on topics just like this one, practical, accurate health information that you can actually use. And if there's a topic you'd like me to cover, drop it in the comments below. Take care of yourself, and I'll see you in the next one.